So now starting with the second part of the reaction video, here we are going to discuss the rest of the things which were discussed in the video, and we will take it forward from here. And as you know, I am Dr. Satya Saraswat, a gold medalist plastic and a cosmetic surgeon, and involved in the field of hair restoration and hair loss since 2006. So let us start and let us jump into the remaining video here.
So later that day, they shaved my head and then we went and did the procedure. The procedure is done not by the doctor, but by a team of nurses. There's probably 5 or 6 people in the room and they're working as a team, pulling the hairs from the back and then inserting them in the front. The whole thing took probably 6 or 7 hours.
Now he discusses his surgery, and the surprising thing is in the clinic, the doctors are not doing the surgery. This is not a practice we would encourage in general in hair transplant clinics. There are multiple steps of the hair transplant, as we know, and many of the steps have to be performed by the doctors, and not everything should be left to the technicians alone. Although in this case the doctor was coming and checking it out, but as per the ISHRS and ABHRS guidelines, hairline marking, local anesthesia, slit making or site creation, and graft extraction has to be done by the hair transplant doctor, and the insertion part in this step the doctor generally takes the help of their technical staff.
The whole thing took probably 6 or 7 hours. The first couple hours you're laying on your face and they're making incisions and pulling the hairs from the back, placing those aside, and they have you turn over and then they insert them where they need to be. It's a really strange feeling. You can feel it going through the tissue on your head, and then they do something that kind of snaps it off into your scalp for lack of a better term, and they do this for as many times as they need to until it is complete. There was definitely some pain in the middle because I think the numbing injection that they gave me was starting to wear off. At the time I didn't know that I could have asked, can you give me some more so that it stopped hurting, but I just stuck in there until they actually injected more. But if you start feeling pain, I would definitely ask to get some more.
Now he says that it took around 6 to 7 hours for the entire procedure, which is quite okay. This is the time it takes, and in fact we have a video about the time taken for the hair transplant, and where we have discussed each steps, how much time it takes for generally a 3000 graft procedure, which you can watch. He did have some pain in between, which he has discussed in the video. Painkiller or the local anesthesia which is given is a combination of a short acting and a long acting local anesthetist. In our practice, a combination of xylocaine and bupivacaine, short acting and long acting, and generally effect starts immediately and is there for a very long time. So it can happen that there can be some pain in between, and which just needs supplementation of the local anesthesia.
So 48 hours after the procedure, my face swelled up like crazy. Here's a picture. You can see I look super hilarious. It is definitely a weird feeling to see yourself all swollen up. You don't even look like yourself. But also at this time, the scab on my transplanted area had fully formed, and it was kind of just like one big thick scab. The swollen face lasted about 2 days. I guess the swelling kind of just fades down your face and then dissipates to the rest of your body, maybe? I don't know. And then at 2 weeks is when the scabs should be fully falling off. Mine hadn't even started falling off, I think because it was such a dense transplant. It was kind of caked on there. So I actually had to take a toothbrush and very gently break up the scabs to the point where I could rub them off. But it was really cool because after that, it revealed the nice tiny little baby hairs that were poking up underneath.
Then he discusses his shampoo on the first day. After 2 days, at around 48 hours, he has some swelling on the forehead and eyes, which is quite normal. There are scabs which takes him some effort to remove them, and in his case he has used a toothbrush, which is, even I'm surprised, because if the scabs are there, quite hard scabs are there, many a time people are very reluctant to touch these transplanted hairs. Then in that case you have to take these heroic measures. In general, if you are taking good care, doing the shampoo daily once or twice a day, then these scabs will not form. Probably in his case the density is very high, as we have seen that 2400 graft procedure has been performed in a very small area. So because of this, there are a lot of scabs there, which is okay, and he has removed the scabs.
Then at 1.5 months, what happened was what I dreaded the most. The shedding phase, of course. All of the hairs that you just are so excited to see poking through, they fall out. Like 60% of them just fall out.
Then at 1.5 months, he shares that his hair fall started, the transplanted hairs, they started falling, which is again quite natural, and this shedding phase can continue up to 3 months sometimes, and the growth actually starts after 3 months.
Bald spots from the shedding hair, but then at 3 months is when they sprouted back through, and that was a huge relief. Now, one thing I did notice is that there was, at the very front line of the hairline, there was a bit of a gap between the first row and the rest of the rows behind it. And I know that they do this to kind of blend it in, but I feel like maybe it would look better if there was just a few more hairs planted in between this, because the gap does seem perhaps a little bit more obvious than I had hoped. Now, I am going to give it time to see if it, evens out and looks and fades and blends in. But yeah, there is a little bit of a space there where you could see the gap between the first line and the rest of the transplant.
Then at 3 months, the growth starts, and later on, that he says that there are some gaps between the front row and the back rows. So this is actually a deliberate step when performing the hair transplant, because if we do not keep these gaps, small gaps, and if we do not make these indentation or irregularities in the hairline, that will look unnatural. So this is quite natural to have these slight gaps, especially in the front 2 rows, and that irregularity is also quite this gives a very natural look, which is seen in his results. It's quite natural there.
12 and 18 months, this is where you will start seeing kind of the final results. So we're getting into that range. It's been exactly 12 months today, and as you can see, the hairs are still pretty fine. They don't look very dense, and they are quite frizzy and kinky. Now, I've been researching and I've got mixed reviews if this is normal or not, the kinkiness, the frizziness. So I'm really hoping that they start to straighten out eventually, but right now it looks like a lot of the shafts are fully frizzy from base to tip. So
then later on, he discusses that his hairs, the transplanted hairs, they feel a bit kinky or frizzy. This is again a normal thing, because here there is a thinning going on in the front. The back hairs are thicker than the front hairs, where the hair loss is progressing. The thin hairs are there. So these thicker hairs do not slightly mix up or bend with these transplanted hairs. And the treatment for this, there is actually no treatment, but the good thing is after around 12 to 18 months, this kinkiness or the frizziness automatically on its own starts decreasing. And if it doesn't, you can do a lot of conditioning of your hairs. Then there are some products available in the market which can take care of this frizziness, but they're not that effective. It's because of your hairs being thicker at the donor side, the characteristic or the quality of which no doctor can change on their own. Only thing is you have to take care of them in a proper way. You need to get a good hairstylist who can do this for you.
I think my hair probably looks the best at about 7-8 months of growth. This is how it looked at that period of time. So yeah, those are my two biggest concerns, I suppose, is the frizziness and the gap at the very front.
Then he discusses that his results were best at 7 to 8 months. This is quite normal, because then they undergo anagen desynchronization, a video about which we have already made, and it's given in the link given here.
And I take minoxidil every day. This is a topical ointment that you put on your head, and this kind of inhibits blood flow to your hair follicles and helps you maintain the hair and stop your hair fall that you might be experiencing. I also have finasteride. This is like the big guns that helps your hair, but I haven't actually started taking that yet because, people do get side effects such as erectile dysfunction, depression sometimes, or this thing called post-finasteride syndrome, where you basically have symptoms like low testosterone.
Then he discusses about finasteride, that he does not need to take finasteride, so because it can cause sexual side effects. So we have again made a detailed video about finasteride and its side effect. The link again is given above. There is another video on our channel, how to stop finasteride if you're experiencing any side effects. The side effects are not seen in all patients. The frequency generally is 2 to 3%, not more than that. A lot of research has been done over this, but if you're not taking finasteride, your basic root cause of the hair loss is not going to be addressed. He says that it's low testosterone. That is actually not right. Finasteride decreases the levels of 5-dihydrotestosterone, which is actually the chemical which is causing the hair loss, and finasteride actually decreases the 5-DHT level, which can decrease the pace at which you are losing your hairs in a natural and a genetic way, or because of the male pattern baldness. If you find this video, we would request you to share this with people who want to know more about this before we wrap up this video. This is our humble request to you.
And there's no shame in going and getting it done and bettering yourself, bettering your appearance.
And in the end, he gives a very, very important message. There is no shame in getting a hair transplant done. People are quite reluctant sometimes that nobody should know about hair transplant. It takes a lot of courage for people to make out videos about it, about the procedure they have undergone. It is very, very common procedure world over now. There are thousands and thousands of hair transplants being done weekly or monthly. So if you're planning a hair transplant for yourself, there is no shame absolutely in getting a hair transplant done. If you want to see one of our hair transplant result videos, you can click the video on the left. And if you want to see something more about natural remedies for your ongoing hair loss, you can click the video on the right.